Hello, I'm Joe. I'm the PA today, and this is my PA student. May I ask who we have today?
Yes, this is my mom.
Hi, I'm Brittany. I am Sam's mom here.
Hello.
Hi, my name is Sienna. Like he said, I'm the PA student. I'll be taking some notes and getting, a feel for what's going on. So why don't you tell me why you're here today?
So my throat really hurts. It's been really sore and getting worse over the past couple days.
Okay. When did this start?
Around 3 days ago, she mentioned that her throat was hurting while we were having breakfast. It was hard for her to eat her food.
Okay. If you could rate your pain on a scale of 1 to 10, with 10 being the worst pain you could imagine and 1 being no pain at all, what would you say your pain is?
I'd say it's a 10.
Okay. When was another time that you had 10 out of 10 pain?
I broke my arm when I was little.
Okay. And you said your pain has been getting worse since it started? Okay. Has she been around any other sick children at all?
Yes, her cousin actually has been having very similar symptoms to this, and they were together over Memorial Day weekend.
Okay. Do you know what her cousin was sick with?
No, I don't.
Okay. Does anything make your throat feel worse?
When I swallow.
Okay. Does anything make it feel better?
My mom gave me some medicine and it started to feel a little better.
Okay.
Yes, I gave her some Tylenol, and that seemed to help her fever and pain a little bit. I also gave her some cough syrup, and that didn't really do anything.
Okay. Did you take her temperature at home?
Yes, it was 101 degrees last night.
Has she had any fatigue or night sweat?
I have noticed her being more fatigued lately.
Any weakness or recent weight loss?
No, but she has had some changes in her appetite. I think it's just from not being able to eat because of the pain.
Have you noticed any new rashes or itchiness anywhere?
Mm-hmm.
Okay. How about any swollen lumps anywhere, like on your neck?
I think I felt some, but I'm not sure that's what that was.
Any eye pain or ear pain, trouble seeing or hearing?
Mm-hmm.
Okay. How about any cough, runny nose,
Mm-hmm.
difficulty breathing? Okay. Have you had any pain in your chest?
Mm-hmm.
Okay. How about any pain in your stomach or vomiting, sick to your stomach, feeling?
No.
No.
She hasn't had any of that.
Do you have any allergies?
To bees and penicillin as well.
Okay.
She did have an anaphylactic reaction once, so we got her set up with an EpiPen, and she has that now.
Great.
And was that to the bees or to the penicillin?
That was to the bees. To the penicillin, I think she just had a rash, if I remember correctly.
Okay. Is she on any other medications?
She is on albuterol. She has asthma, and she only uses that before she goes outside and does some physical activity or anything like that.
Has she had any surgeries in the past?
No, she hasn't.
Are there any medical problems in the family?
I don't have any medical problems. My dad, he has something with his heart. I think it's high blood pressure. Same thing with my mom. I think she has high blood pressure. And then I'm not sure about her father's parents, what their medical history is.
Okay. And now I'm just going to ask you a few silly questions. Have you ever tried alcohol or tobacco before?
Nope.
Okay, good. Is there any tobacco exposure in your home?
No.
Who do you live with?
My mom, my dad, my sister, and our dog.
Good. And are you happy at home?
Mm-hmm.
Feel safe at home?
Yes.
Okay, good. And do you do well in school?
Yes.
Okay. And you exercise a lot?
Mm-hmm.
Right.
Every day.
Okay, good. All right. Those are all my questions. Anything else that you want to ask or anything? Could get started with the exam then.
Okay, so vital signs were taken before the PA and the PA student entered the room. Blood pressure was 110/63, right arm seated. Temperature was 101.3 degrees Fahrenheit on the right ear canal. Pulse was 94, respiration's 18. The patient's height is 50 inches and the weight is 57 pounds, which is equivalent to 25.9 kilograms. The patient is calm and cooperative during the exam. Facial expressions indicate pain with swallowing. All right, can you tell me your name?
I'm Samantha.
And what day is it, if you know?
Today's Thursday.
Okay. And do you know where you are right now?
I'm at a doctor's office.
Perfect. Alrighty, so I'm going to be doing the exam for you, so if you could please take your shirt off so I can take a look at your skin, if that's okay with Mom.
Yes, it's okay. Would you like me to move out the way a little bit?
Yes, please, if you can. Camera. Perfect. And then I'm just looking for any rashes. Have you noticed like any bumps or new rashes on your skin? Can you hold your arms out for me? Oh, excuse me. Oh, you can set them down if you can move your hair to the front for me. Thank you. I apologize if my hands are a little cold. Skin. Am I blocking it?
Yeah.
All right, and I'm now just gonna palpate your head. I want you to tell me if there's any tenderness or if you feel any pain anywhere. Any pain on your ears, front?
No.
Any pain with your nose?
No.
No? Okay. Going to take a quick look in your ears for me.
Doing a great job, Sam.
Thank you.
Look at your present.
Do you have an ear that you prefer first?
No.
Okay, I'll take a look in this ear.
Okay.
Can you move your hair out of the way for me? Okay. Everything appears to be normal. No erythema. I'm now going to take a look in your throat. Oh, I'm sorry. I'm going to take and feel your neck and just feel for any masses or if there's any bumps. And then can you turn your head to one side yet? And then go to the other side. Okay, and then you straighten your head. I'm going to ask you to take a deep breath in and hold it, and then I'll tell you when to breathe out. All right, you breathe out. So there's lymphadenopathy felt in the preocular and superficial, or in the tonsillar nodes. Now I'm going to take a look in your mouth. Sam, if you can open your mouth for me and say ah. Thank you. You stick your tongue out for me. And then can you lift your tongue out? Perfect, thank you. The patient's tonsils are erythematous, edematous, and there's exudates bilaterally. All right, Sam, you can put your shirt, oh, I'm sorry. I'm going to listen to your lungs real quick. So if you can cross your arms for me. And then take a deep breath in when you feel this touch your back. No rales, wheeze, or rhonchi, and then lungs were clear bilaterally. And I'm also going to take a quick listen to your lungs. Can I move these?
Yeah. Here, you can hold
Mom,
them.
I'm going to hand these to you.
Thank you.
And if you can lay down, just going to take a quick listen to your heart. And can you move your sports bra so I can? Thank you. go ahead and you can put your shirt back on if you'd like.
Great job, sweetie.
Thank you, Mom.
Get you another stuffed animal after this.
And then for the cardiac, S1, S2, no rails, rubs, or gallops were heard. So after completing the exam, I believe that your daughter has a strep throat. So because of that, we're gonna start her on antibiotics. Is that okay?
Yes,
that-
that's okay, as long as
okay.
it's not the penicillin that she's
Right,
allergic
right.
to.
Okay, so what I'm thinking, because of her penicillin allergy, we're gonna start her on azithromycin.
Okay.
Now for you, Sam, would you prefer like a liquid, like a syrup, or do you think you can swallow like a pill?
A liquid.
A liquid?
Mm-hmm.
Okay, so we're gonna start her on azithromycin, 200 milligrams for every 5 milliliters. And so after the calculation, it's gonna be, Mom, you're gonna dispense 7.8 milliliters once a day for 5 days.
Okay.
And when you're gonna give it to her, make sure you shake the bottle. If you don't, she won't get the right amount of medication.
Okay, do I just shake it as a bunch?
Yeah,
Okay.
yeah. It's kind of like it'll rest on the bottom, so we just want to get it to where it's almost like orange juice.
Okay.
Sam, it's your responsibility to make sure your mom does that.
Okay.
Hold me
Also, I
accountable.
want you to, if you ever feel like when you're taking it, like if your stomach hurts at all, if you notice like any new rashes, if you feel like any nauseous, or if you have diarrhea, let your mom know. These are common side effects of the antibiotic.
Okay. I'll be staying home with her and making sure.
Okay, and then same thing with the Tylenol. We're gonna do a solution as well. It's 160 milligrams for every 5 milliliters, and we'll do 8 milliliters by mouth for every 6 hours as needed for her fever.
Okay.
We'll write this all down.
Perfect.
For
I
you.
was
Correct,
just gonna
yeah,
say.
And I'll write it down for you, and I'm gonna fax this over, so you won't have to worry about write or giving a prescription.
Perfect.
It'll all be faxed over to your pharmacy.
Perfect. Thank you. When can she go back to school?
Okay, so that's the other thing. For her, we're gonna keep her home. I know the school year's wrapping up, but unfortunately, we're gonna keep her home for the next 3 days for the antibiotic to kick in. And make sure with the antibiotic, she may feel better, as soon, let's say, if she starts getting it today, she can start feeling better tomorrow. Make sure that she completes the entire dose, or else it can come back.
Okay. Will do.
You can try gargling salt water if that helps, or different temperatures for the fluids. And we just would like to see you back in 10 days, or if symptoms worsen.
Okay.
Other than that, do you have any questions for us?
No, you're both so thorough and kind. I appreciate it, and I'll go ahead and schedule that 10-day follow-up.
Awesome.
All right, thank you.
Thank
Thank
you.
you.
Feel better.